So whenever we plan surgery, we continuously assess risk. Risk assessment, minimization of risks on the day is a continuous exercise in order to achieve the best possible outcome. There are risks related to previous medical history of each patient. This will be assessed when we see you in clinic and we go through your previous medical history and previous eye history. This will be taken into consideration in the planning of your surgery, in the selection of the procedure, in the selection of your lens, and I will explain all of this to you individually. There are risks that are assessed on the day. This depends on your medications or particular situation, motility requirement, some positioning requirement due to your breathing needs, anxiety, or the particular anatomical features of your eye and prescriptions. And again, this will be explained to you, and on the day of surgery, the team in theatre will be all made aware of all this. There are risks that can also follow the procedures, and these are related to the healing phase, recovery phase after surgery. Again, there is an element of individual healing that is variable for each patient. Healing can be affected by other medical conditions, and again, this will be explained to you. There is also an element of variability due to different reaction to different treatments. There are common risks that we always explain that they apply to the general population, but these are very low. Generally, cataract surgery, lens surgery is a very safe and routine procedure. It's the most common procedure practiced worldwide. There is less than 1 in 1,000 risk that something serious may happen, such as a bleeding, infection, or something serious on the retina that may affect the vision outcome at the end or may lead to loss of vision. These are extremely rare risks. There is less than 5% risks that patients may need a second operation to reposition the lens, replace the lens, or carry out further surgery on the retina, should there be any complications on the retina following the primary cataract surgery. There is less than 1% risk, as this is reported by the National Audit for Cataract Surgery, of having an intraoperative complication affecting the capsular bag and requiring vitrectomy, which is the removal of the vitreous gel at the time of cataract surgery. Although this risk is reported to be 1% in the National Audit, UK, this is much lower in the hands of an experienced consultant, and it is much lower in my personal audits. All these risks will be discussed with you, and the expectation of the recovery phase after surgery will be explained to you in details before the surgery, on the day of surgery, and at your postoperative consultation. So you will be assisted, all your queries will be answered at each stage of your treatment. So if you're considering cataract surgery and you are worried about making a mistake in choosing treatment or deciding where to go, please leave us your contact number or email address and we'll send you a short guide on cataract surgery. We explain also what happens and how to avoid common mistakes that people make when considering cataract surgery.